Welcome back, everyone, to the deep dive. Ready to dive into another fascinating topic. Today, we're tackling psychopharmacology.
A bit of a mouthful, huh? But basically, we're going to be looking at how medications are used in mental health treatment for both children and adults.
Right, and we've got some really interesting excerpts to work with today. The Handbook of Clinical Psychopharmacology for Therapists. So,
It's a great resource, really dives into the nitty-gritty of, how therapists can work effectively with medications in the treatment process.
yeah, from what I've seen, the book really stresses that whole collaborative aspect of treatment. Makes it clear that therapists aren't just there to talk. They're also really key players in monitoring how their patients are responding to medication.
Oh, absolutely. I mean, therapists have such a unique vantage point, right? They're seeing these patients regularly, observing changes in their symptoms, maybe noticing side effects. They might even pick up on things that the prescribing physician might not catch in a quick med check.
That makes a lot of sense. I mean, you're right. A therapist is going to have a much more in-depth view of the patient's day-to-day life.
Exactly. So it's really a partnership, a really beneficial one for the patient to have both the therapist and the physician working together.
For sure. And speaking of things therapists need to be aware of, the handbook highlights 6 specific situations where it's really essential to reevaluate medication treatment, almost like red flags, signaling that something needs to be adjusted or investigated further.
Yeah, those red flags are super important. And the first one they talk about is failure to respond, which basically means the medication just isn't working as intended.
That makes sense. But I imagine it's not always straightforward. I mean, how do you know for sure if it's truly a failure to respond or if maybe it just needs more time?
Right. That's where the concept of an adequate trial comes in. You need to make sure the patient's been on the right dosage for a long enough period of time before, you can definitively say it's not effective.
So it's about giving it a fair shot, not just giving up too quickly.
Exactly. Now, even when a medication is working, there's still the possibility of what they call a partial response, meaning, maybe it's helping, but the patient is still struggling with some symptoms.
Okay, so in that case, what's usually the next step? Do you try adjusting the dosage or maybe consider adding another medication?
Yeah, those are definitely options. It often comes down to fine-tuning. Treatment's not one size fits all, so you got to figure out what works best for each individual.
Yeah, for sure. Now, another thing the handbook mentions is something called unexplained relapse, which sounds a little unnerving. What causes that?
Well, unexplained relapse is when symptoms come back, seemingly out of nowhere. And it can be for a few different reasons. Maybe the patient isn't taking their meds as prescribed, or maybe there's substance use interfering with the treatment. Sometimes it could even be a brand new medical condition contributing to the symptoms.
Wow, it really does sound like detective work sometimes.
It can be. You got to really look at the whole picture. And that's why it's so important for the patient, the therapist, and the doctor to all be communicating openly and honestly.
Makes sense. Everyone's got to be on the same page. Now, what about those situations where a medication that was working fine suddenly becomes a problem? Does that actually happen?
It definitely does. You have to remember our bodies are constantly changing, right? So sometimes those changes can affect how we respond to meds.
So things like aging or...
Aging, exactly. Or new medical conditions cropping up, even something like pregnancy. All of these things can mean a medication needs to be reevaluated.
Wow, so many factors to consider. And then, of course, there's the whole issue of side effects, which can be a big concern for people.
Absolutely. Every medication has the potential to cause side effects. It's just the nature of how they work. Some side effects are mild and temporary, but others can be more persistent and troublesome. So it's always a balancing act, weighing those benefits against the risks.
And I imagine that's where the therapist's role is so important, right? Helping the patient to understand and manage those potential side effects.
Exactly. A therapist can really make a difference. They can educate the patient, help them develop coping mechanisms, and advocate for their needs with the doctor if necessary.
Right. It's about finding that sweet spot where the medication is actually helping more than it's hurting.
Exactly. Now, the last red flag the handbook talks about is discontinuing medication. And it's not as simple as just stopping the pills.
Yeah, I was going to ask about that. What are some of the things to keep in mind when someone wants to stop taking a psychotropic medication?
Well, first off, you have to consider the type of medication. Abruptly stopping certain medications, especially those that affect brain chemistry, like antidepressants, can lead to withdrawal symptoms or even trigger a relapse.
Okay, so safety is a big concern.
Definitely. You got to be really careful. The decision to discontinue should always involve careful consideration of the patient's history, their risk of relapse, and their own feelings about stopping the medication.
Right, it's got to be a joint decision between the patient and the doctor.
Absolutely. And often the safest approach is to gradually taper off the medication.
Okay, that makes sense. So we've covered the red flags for adults, but what about kids? I imagine there are some specific considerations when it comes to treating children and adolescents with medication.
Oh, for sure. The handbook makes it very clear that treating kids is not just about shrinking down adult treatment plans.
Right? They're not just miniature adults.
Exactly. They have unique developmental needs. And we need to be extra careful when we're talking about diagnosing and treating mental health issues in children.
Now, why is that? What makes it so different for kids?
Well, for one thing, their brains are still developing, so they might react to medications differently than adults do. Plus, it's really important to be able to distinguish between true mental illness and just typical childhood behavior.
Yeah, that line can get blurry sometimes, especially with kids.
It can, and we don't want to overdiagnose or overmedicate. It's a delicate balance.
For sure. Now, the handbook also mentions that certain mental illnesses like OCD and bipolar disorder can actually start in childhood. So what are the implications of that?
Well, it really emphasizes the need for early intervention. If we can identify and treat these conditions early on, it can make a huge difference in the long run.
Because if those conditions go untreated,
It can have a really significant impact on a child's development, their education, their whole well-being.
so it's crucial to catch it early.
Absolutely. But it also raises the question of how do we accurately diagnose these conditions? In young people, their symptoms might look different than they do in adults. So it's a real area of ongoing research and discussion.
So much to consider when it comes to kids. It's definitely more complex.
It is. But, the good news is we're learning more all the time. And the more we understand about the complexities of psychopharmacology, the better equipped we are to help both children and adults live healthier and happier lives.
Well said. I think we've laid some really solid groundwork here, but I'm eager to dig a little deeper into the specific medications used in psychopharmacology and how therapists can help patients navigate all the nuances of treatment.
Let's do it. I'm ready to dive into those details. All right. So where do we even begin? I mean, there are so many different medications out there used in psychopharmacology.
I know, right? It could be overwhelming. I guess a good starting point might be antidepressants. I mean, those are probably some of the most commonly prescribed medications for mental health, right?
Oh, absolutely. Antidepressants are used to treat a whole range of conditions, depression, obviously, but also things like anxiety disorders, even some chronic pain conditions. It's pretty remarkable.
Yeah, I remember seeing in the handbook that they talked about several different types of antidepressants, like tricyclics and SSRIs. What's the difference between those? I always get those mixed up.
Yeah, it's easy to get them confused. There are a lot of options, but basically, tricyclics are an older class of antidepressant. They work by blocking the reuptake of serotonin and norepinephrine in the brain. They can be pretty effective, but they also tend to have more side effects than some of the newer medications.
Okay, that makes sense. So SSRIs, which I think stand for selective serotonin reuptake inhibitors, those are newer and have fewer side effects, is that right?
Yeah, that's the gist of it. SSRIs specifically target serotonin, which is a neurotransmitter that plays a role in mood regulation, and by being more targeted, they tend to cause fewer unwanted side effects.
So I guess for someone who's just starting out on antidepressants, an SSRI might be a good first option.
In many cases, yes, but it's not always that simple. The best choice of medication really depends on the individual. Specific symptoms, medical history, potential drug interactions, all that good stuff.
Right, everyone's different, so there's no one-size-fits-all approach.
Exactly. Now, the handbook also mentions another type of antidepressant called MAOIs, which stands for monoamine oxidase inhibitors. These guys work by inhibiting the enzyme monoamine oxidase, which breaks down neurotransmitters like serotonin, norepinephrine, and dopamine.
Okay, so they work a bit differently than tricyclics and SSRIs, or MAOIs. Commonly prescribed?
Not as commonly as the others. MAOIs can interact with certain foods and medications, which can cause some pretty serious side effects. So they require a really strict diet and careful monitoring. So they're usually reserved for cases where other treatments haven't worked.
Gotcha, so they're kind of like a last resort option.
You could say that. Now, moving on from antidepressants, another category of medications we should talk about are antipsychotics.
Oh yeah, antipsychotics. I've heard that term, but I'm not really sure how they work or what they're used for.
Right. So antipsychotics are mainly used to treat conditions like schizophrenia and bipolar disorder, where psychosis can be a major symptom.
Okay. And psychosis, what exactly does that mean in this context?
Well, psychosis is basically a mental state where someone loses touch with reality. They might experience hallucinations, delusions, disorganized thoughts, agitation. It can be really distressing for the person experiencing it and for those around them.
Wow, that sounds really intense. So antipsychotics help to manage those symptoms and kind of bring the person back to reality.
Exactly. They work by blocking certain neurotransmitters in the brain, especially dopamine, which is thought to be involved in the development of psychotic symptoms.
That makes sense, but I do remember the handbook mentioning that. Antipsychotics can have some pretty serious side effects too, like tremors and muscle stiffness.
Yeah, that's true. Those are called extrapyramidal symptoms, and they're related to the medication's effect on the dopamine system. So it's a tough call sometimes, weighing the benefits of symptom relief against the potential for these side effects.
And that's where the therapist role comes in again, right? Being that watchful eye and communicating with the doctor if those side effects become too much.
Exactly. Therapists need to be on the lookout for those side effects and be ready to advocate for adjustments to the medication if needed. The handbook actually has a whole section on the signs of toxicity and overdose for different medications.
Really, that seems like essential information for therapists to have. What are some general signs of toxicity that someone might need to watch out for?
Well, things like oversedation, confusion, problems with coordination, even seizures, those are all red flags that need immediate medical attention. It's always better to be safe than sorry.
For sure. Okay, so we've talked about antidepressants and antipsychotics. Are there any other categories of medications we should cover?
Yeah, let's talk about mood stabilizers. Those are primarily used to treat bipolar disorder, which we touched on earlier. It's characterized by those extreme shifts in mood, energy, and activity levels.
I've heard of lithium being used for bipolar disorder. Is that a mood stabilizer?
It is. Lithium is one of the classic mood stabilizers, been used for decades, and it's still considered effective. But there are other options too, like anticonvulsants, which were originally developed to treat seizures.
Oh, that's interesting. So they kind of have a dual purpose. Why would anticonvulsants be helpful for bipolar disorder?
Well, it turns out some of them have the mood stabilizing properties, and they can be really helpful for people who won't respond well to lithium or who have side effects from it.
So again, it's all about finding the right fit for each individual.
Exactly. Now let's move on to another common category, anti-anxiety meds, also known as anxiolytics.
Yeah, I've heard of those, especially benzodiazepines. Those are often prescribed for like short-term anxiety relief, right?
That's right. Benzodiazepines work pretty quickly to reduce anxiety symptoms, but they're not really recommended for long-term use because of the potential for dependence and withdrawal.
So they're more like a temporary fix, not a long-term solution. Are there other options for anxiety besides benzodiazepines?
Oh yeah, definitely. Some antidepressants can also be helpful for anxiety, and there's a medication called buspirone, which works a little differently than benzodiazepines and has a lower risk of dependence. And of course, therapy and lifestyle changes are also super important for managing anxiety.
So it's that multifaceted approach again, just like with most mental health conditions.
Absolutely. The handbook even mentioned antihistamines as a possible treatment for anxiety, which I thought was kind of interesting.
Really? I thought those were just for allergies.
Right. But some antihistamines can have a sedating effect, which can help to reduce anxiety in certain situations, like pre-flight anxiety or stage fright.
Huh, that's fascinating. I'm learning so much about all the different ways medications are used in psychopharmacology.
It's an amazing field, and it's constantly evolving. New medications are being developed all the time. But it's important to remember that medication is just one piece of the puzzle when it comes to mental health treatment.
Right, it's not a magic bullet.
Nope. It's about finding the right combination of medication, therapy, lifestyle changes, and support systems to really achieve lasting well-being.
Well said. I feel like we've covered so much ground already, but I'm really curious to hear more about that holistic approach you mentioned and how we can best support people on our mental health journey. All right, so we've talked a lot about medications for adults, but let's shift gears and talk about kids. I know we touched on this a bit earlier, but treating children and adolescents with medication seems like a whole other ballgame, right?
Oh, absolutely it is. The handbook really stresses that. You can't just take an adult treatment plan and shrink it down for a kid. It doesn't work that way.
Right, because kids aren't just miniature adults. They have their own unique needs.
Exactly. Their brains and bodies are still developing, and that adds a whole layer of complexity to medication management.
So what are some of the things that therapists really need to keep in mind when they're working with kids and teens who are on psychotropic medications?
Well, first and foremost, close monitoring is key. A child's dosage needs can change pretty quickly as they grow, so regular communication with the prescribing doctor is super important.
So it's really a team effort then, the therapist, the doctor, the parents, everyone working together.
Absolutely, and therapists play a crucial role in that team by providing those observations about the child's behavior, their mood, any side effects they might be experiencing. They can also be a great resource for parents, helping to educate them about the medication and address any concerns.
So it's about empowering everyone involved to make it informed decisions.
Exactly. And another big thing to consider is the potential impact of medication on the child's development. Some medications can affect things like growth, sleep patterns, appetite. So those are all things you want to keep a close eye on.
Yeah, you don't want to solve one problem just to create another.
Right. It's about looking at the whole picture, making sure the child's overall well-being is the priority.
Now, I know we talked about this a bit before, but the handbook mentioned that some mental illnesses, like OCD and bipolar disorder, can actually start in childhood.
Yes, and that really highlights the importance of early intervention. The sooner these conditions are diagnosed and treated, the better the outcomes tend to be in the long run.
But I imagine diagnosing those conditions in kids can be really tricky.
It can be, yeah. Their symptoms might not always present in the same way as they do in adults, so it's a real challenge to make sure we're not over-diagnosing or over-medicating.
So it's a balancing act, finding that middle ground.
Exactly. And that's where a skilled therapist can be so valuable. They can help gather information, observe the child's behavior, and work with the family and the doctor to figure out the best course of action.
This has been a really eye-opening deep dive. I feel like we've only scratched the surface of psychopharmacology, but we've covered so much important ground.
We have, and for everyone listening out there, remember this is just a starting point. This information is here to empower you, to have more informed conversations with your healthcare providers about your mental health or the mental health of your loved ones.
And as always, we encourage you to keep learning, keep asking questions, and keep advocating for your own well-being. That's what it's all about.
Absolutely. And as we wrap up this deep dive, I want to leave you with a question to think about. How can we as a society reduce the stigma surrounding mental health and make sure that everyone, regardless of age, has access to the care and support they need?
That's a powerful question, and one that we all need to be thinking about. Thanks for joining us on this deep dive into psychopharmacology. We'll see you next time.